that is a difficult question and hard to sort of boil down to three things. But I think if I could say in rank order, the first thing that we've got to figure out is how we're going to finance this system. And I don't think that we have given enough thought to exactly how we're going to do that, because it's obvious that child care, especially in this country, costs more than most families can afford. And so we've got to figure out how to pay for it, which gets me to the second biggest challenge I think that the country has, and that's what do we do with the workforce? Because we need a better trained workforce, but if we can't afford to pay them what either the cost of getting that training or what it takes to keep them after we've trained them, then that's useless. And so I think those two things are sort of they're interconnected, and they really require some pretty hard thinking. And then I think the last challenge is that how we communicate the messages about early care and education to parents, because I think we have created a situation where, and I say this with respect, that we've turned parents into inspectors because we don't give them enough information about the quality issues. And so we give them checklists and we say, okay, go find a program and ask them, do they have a degree? Do they have a background check? Do they have CPR and first aid? We're making them inspectors, and we should be doing that task in the public sector. And so parents should have some comfort that any program they go to, there's a certain level of safety and health built into it. Well, I think the first thing that the advocates can do is communication with the public. And one of the things that I've been really spent a lot of time thinking about is how do we communicate to parents, to the public, to anyone who's interested in this subject in terms that they understand. I think we have too much insider speak in early childhood, and we need to boil the message down so that parents and the person who's not schooled in early childhood development understands it. So, for example, at HHS right now, I say to everyone, I can boil it down to 4 things that we need in early childhood. We need to know that whenever children are paid for by public money, that they are safe, healthy, happy, and learning. And how hard is that? So that people know what it is we're trying to say we're doing here, instead of getting into a lot of jargon that no one gets. Well, I think those 2 groups in particular are absolutely critical. Business and the military are 2 groups that are sort of non-traditional, although they get the importance of it now. And so how do we engage at the local level? Well, you go and talk to people. And I think one of the things that I find sort of confusing about our field is that we talk too much to each other and not enough to people outside. And so we need our own early childhood advocates reaching out and talking to these folks in ways that, as I said, they understand, but then engaging them, helping them see what we mean when we say safe, healthy, happy, and learning. What does that mean to the average person? So get them into programs. Talk to them about it. Talk to them about the issues of cost, for example. How much does it cost to do this right? A businessman gets that. So why aren't we talking about cost and financing to the business community who can help us then figure out how to finance this, for example? Or in the case of the military, the data is all there about the number of people who don't qualify for the military based on their scores, their test scores. The military gets the need for this. So how is it that we reach out to the military, get them in, and get them engaged so that they support good early childhood programs? And we need that. We need that in other areas. The health community, that's another group that clearly understands the need for higher quality care. How are we engaging them? I always say to people, at the end of the day, it's the elephant, and it's where you touch the elephant, where you stand, how you see it. And we need to stop looking at the elephant from just our own lens, but go to the other side of the elephant and see what it looks like from their lens, and then talk to them about it. And I think maybe we can break down some of these barriers and get these people engaged. But that happens at the local level, it doesn't happen. It won't work if it doesn't happen